Hey everyone, and welcome. Today, we're diving into what is honestly one of the most powerful diagnostic tools in all of medicine, the arterial blood gas test, or ABG for short. Think of it as a crucial piece of the puzzle that helps doctors figure out exactly what's going on deep inside a patient's body. So let me ask you this. What if your blood could actually talk? I mean, really tell you a story. Well, in a lot of ways, that's exactly what an ABG does. It's like getting a direct message, a real-time snapshot that reveals the secret chemical conversations happening between your lungs, your kidneys, and, well, your entire body. Okay, so let's start with the basics. To really get a handle on the ABG, we first need to break down what this test is, and maybe more importantly, what it's even looking for. At its heart, an arterial blood gas is a test that measures the gases, we're talking oxygen and carbon dioxide, and the pH, which is just your acid-base balance, in blood taken straight from an artery. And this isn't just some random checkup, it's a super precise measurement of your body's most critical functions. So who are the key players in this chemical story? First up, you've got pH. This is the master indicator, the big boss, that tells us about the body's overall acid-base balance. Next is PaCO2, which is our window into the lungs. It shows how well they're getting rid of carbon dioxide. Then there are two ways we look at oxygen. PaO2 is the oxygen just floating around in your blood, while SaO2 is the oxygen that's actually hitched a ride on your red blood cells. And finally, we have bicarbonate, or HCO3-. This little guy represents the metabolic side of things, a system run by your kidneys. You put them all together, and you get a really complete picture. Now, you might be wondering, why does it have to be arterial blood? Can't you just use any old blood sample? Nope, and here's why. Arterial blood is fresh from the lungs, so it's packed with oxygen, giving us the truest picture of how well you're breathing. Venous blood, on the other hand, is on its way back to the lungs after dropping off oxygen to all your tissues. As you can see, its oxygen level is way lower, which makes it pretty useless for checking on your oxygenation. And that brings us to a really crucial point. The ABG isn't just some interesting test. In a lot of clinical settings, it is an absolute lifesaver. Let's dig into why it's considered such a critical tool. I mean, just look at this list. An ABG becomes absolutely essential in these incredibly high-stakes situations. For a patient who can't breathe, it tells us exactly how well their lungs are or aren't working. In something like diabetic ketoacidosis, the body's pH can drop dangerously low, and the ABG is what quantifies that danger, guiding everything from insulin to IV fluids. And for crises like septic shock or cardiac arrest, this test gives doctors an immediate, vital snapshot that helps them make split-second decisions. It really is a gold standard for taking care of the sickest patients. All right, now for the part you've been waiting for. How in the world do we make sense of all these numbers? I know, it can seem kind of intimidating, but there's a simple, systematic way to interpret the results. Let's walk through it together. First things first, you gotta know the rules of the game, and these right here are the normal ranges. Think of a pH of 7.40 as the absolute perfect sweet spot. Anything below 7.35, and we're in acidosis. Anything above 7.45, we're in alkalosis. The other numbers are gonna tell us why that imbalance is happening. And here it is, the four-step method that makes reading an ABG totally manageable. Step 1, just look at the pH. Is it low, meaning acidic, or high, meaning alkaline? Simple. Step 2, check the PaCO2. Are the lungs the problem here? Step 3, look at the HCO3-. Are the kidneys and your metabolic system the culprits? And finally, step 4, you check for compensation. Is the body trying to fight back? Now, to make steps 2 and 3 even easier, I'm going to let you in on a little pro tip, a mnemonic that pretty much every medical professional lives by. Just remember the word ROME. It stands for respiratory opposite, metabolic equal, and trust me, it's the key that unlocks the whole thing. Let me show you how it works. So the RO in ROME stands for respiratory opposite. All this means is that for a respiratory problem, the pH and the PaCO2 will move in opposite directions. So for example, if the pH is low, meaning acidosis, the PaCO2 is going to be high. See? Opposite. That happens when the lungs aren't breathing out enough CO2, causing it to build up as acid. Opposite directions always means a respiratory cause. And here's the other half of our magic word. ME, for metabolic equal. For a metabolic problem, the pH and the bicarbonate move in the exact same direction. They're in it together. So if the pH is low and the HCO3- is also low, you've got metabolic acidosis. If they're both high, it's metabolic alkalosis. Same direction, metabolic cause. See, it's that easy. But hold on, the story doesn't end there. Because our bodies are just incredible, right? They don't just sit back and let these imbalances happen without putting up a fight. The body is constantly performing this delicate balancing act to try and fix itself. And this amazing balancing act is called compensation. Basically, if the problem started in the lungs, the kidneys will kick into gear to try and correct the pH. And if the problem is metabolic, the lungs will adjust how fast you're breathing to compensate. It's some seriously amazing internal teamwork. And here's the really cool part. Compensation tells us a story about time. See, the lungs can start to compensate within minutes just by changing your breathing rate. But the kidneys, they're powerful, but they are slow. It can take hours, sometimes even days, for them to really make a difference. So if you see the kidneys trying to compensate for a lung problem, that's a huge clue that this isn't something that just started. It's probably a more chronic, long-standing issue. So there you have it, the ABG. It's a simple blood test that tells an incredibly complex and vital story about what's going on inside our bodies. It's a great reminder that by learning how to interpret these numbers, we are, in a very real way, learning to listen to the body's chemistry. And that just makes you wonder, right? What other secrets is it waiting to tell us?